guys. Good evening. My name is Emer. Diego. I am the speaker for the webinar today and for the upcoming webinar. So welcome, and I hope you enjoy our sessions today. And of course, before we start, please do follow me on my social media accounts. Everything will be at Emer Diego, and of course, please do follow the Philippine Nurse Association UK's accounts, all social media platforms. And of course, do subscribe on my YouTube channel, okay? So the expectation today, we'll be discussing more about the tips and of course, the common mistakes about the OSCE. I will not be discussing the OSCE in depth, okay? So of course, this will be beneficial for the people who will be taking the examination very soon. So if in case you don't have any idea what the OSCE is, of course, probably you need to watch probably some of my videos on my YouTube channel. So you can see some of the explanation about the OSCE in there. But today, I will be sharing to you guys the common mistakes that nurses commit on the examination. So it will be definitely beneficial to the nurses who will be taking the examination soon. So probably after you've done your proper OSCE training, try to revisit this video and it will all make sense. The information that I will be sharing you tonight, it's based on my experience teaching the OSCE from our previous nurses who took the OSCE. They've shared their experiences with us. And of course, it's from the NMC. Okay? So this very first slide, it's from the NMC. According to them, please try not to be scripted. I know at some point you will develop your script, but I do suggest, please remember the marking criteria and of course, try to simulate different conversation with your patient, okay? I know probably some of you might not agree because I know you are preparing your script for the OSCE, which is fine. It's happening, definitely. For me, in my experience, I did prepare my script for the OSCE. But again, please try as much as possible to make the conversation natural. Of course, respond to the conversation appropriately, okay? Because let's say, you did not prepare this topic during your preparation, you will not discuss it. Okay, let's say if the patient talks about, let's say, dying, that is the patient's concern. Of course, you talk about it. Do not dodge the conversation. Have a conversation about it. Again, probably some of your review centers or your trust, they give like a pattern or like a script on your examination. Of course, you can follow that. But of course, as much as possible, try to make your conversation natural, okay? I know the struggle, we are trying, but again, it's hard because English is not our first language. Again, so my tip for you guys is, of course, practice with each other and try to simulate different scenarios. And so once you encounter that scenario in the examination, you know how to respond. The next step which is really useful. This next slide is from the NMC. Okay, according to them, it is helpful to verbalize what you are doing for aspects of practice that cannot be observed easily. For example, checking the expiration date. We all know if you've seen the marking criteria, you've seen that checking the expiration date is important. Okay, because of course, you cannot give a medication which is expired. It may kill the patient. Can you imagine you're giving an expired medication? So why do you need to verbalize it? Because again, reading this sentence, because the examiner won't know if you're actually checking it. So you have to say it. Okay, got it? So you have to say it. So you have to say what you're thinking and what you're doing. Pinching of the skin. Let's say, remember for your subcutaneous injection, you need to pinch the skin. On the examination, the assessor will not go beside you, okay? Remember guys, on the examination, the assessor will stay in one corner only. They will not go near you, okay? So pinching the skin is, it's not too observable. You cannot really tell that you're pinching the skin. So you have to say it. Okay, let's say, remember on your IM, when you inject the needle, there should be a 1 centimeter left hanging. So you have to say it. Why? Because the assessor cannot see you doing it, okay, from afar. Okay, I hope that makes sense. The next line of this tip and the common mistake slide is, you do not need to verbalize things that are easily observed. For example, steps of checking, of doing the hand hygiene. Okay? This is according to the NMC. So according to the NMC, you don't need to say the steps of hand hygiene. Remember this slide. For the things that are easily observable, you don't have to say it. It's from the test center, okay? So they're telling us what to do, okay? Or what not to do, okay? This is very important. You have to listen and pay attention to your examiner. I don't know if you heard from your friends who took the examination probably not too long ago. The examiner sometimes hints some answer on the examination, okay? Sometimes, let's say you're lost. Sometimes the examiner actually will be helping you in the examination. But the most important thing is you pay attention to them. You have this tunnel vision. Okay, you have this tunnel vision. You tend not to, let's say, be mindful of your environment, and that includes your assessor. Sometimes they are telling you some instruction on the examination. One common instruction that the assessor will tell you is that the equipment has been checked, cleaned, and calibrated. Okay? So that means you don't have to check it again. Okay? You don't have to say it again. Sometimes one of the instructions that the examiner might be telling you on the examination is, the checks have been done. You've checked the patient's name already. You've identified that this is your patient. So that means to say, you don't have to check it again. Because why? You will be wasting your time. On the examination, you pay attention to your examiner. Always remember that the examiner wants you to pass. Remember, the UK, we are short of 50,000 nurses. Okay? They are on your side. So make sure to listen to them. From the accounts of the nurses who took the examination recently, according to them, the examiners are really nice. Okay, I know if you've heard that from your friends who took the examination recently. Next is, so read the instructions carefully, as these will confirm what is being required to be completed at the station. So for all the stations, guys, there will be a document, and the document contains the instruction regarding the scenario and what is required of you on that station. So let's say for assessment, for the skill station, there is a document that you have to read. And reading the document is part of the time. You need to read the document fast and make sure to understand what is required of you on the scenario. Okay? So that is the only explanation I can give you on this examination. I mean, on this slide rather. Let's check the chat. May we mark these documents like use highlighter? That's a good question, Jur. So Jur is asking if we could highlight the documents. Unfortunately, the exam centers will provide the necessary writing materials, okay? Let's say a pen, and that's the only pen you could use in the examination. Again, the examiner will give you instruction. Normally, you cannot write on those documents because remember, those are legal documents. We consider this as a patient's document. And normally, we do not tamper patient's documents. Yeah? Let's say, and yeah, that's it. Same with, I think, Kim is also asking the same question. Can we write anything on that part? Normally, there are scenarios which you're required to write your name. Okay? Or there are skills wherein you have to sign and documents, let's say skills that you're required to give a medication. Let's say administration of inhaled medication. Of course, you need to sign it. So remember, the entire document is a legal document. So you have to treat it as a proper document. So you cannot just scribble on it. Okay. So once they give you the paper, of course, try to prioritize writing your name. Normally, do not. I mean, there are fails on the examination because of not writing the name and not writing the date, not writing or not signing the document. Okay, so make sure once they give you the document, you need to spot where to sign. Okay, you need to spot because we don't want to fail the examination because not writing our name. Okay, there are a lot of nurses, surprisingly, who failed the examination because of not signing the document at all. Okay, all right. The next slide is you have the opportunity to familiarize yourselves with the equipment on the examination. Okay. So before you start any skills, any station on the OSCE, the assessor will normally orient you on the station. Okay. They would normally tell you what the equipments that you will be using. They will be asking you if you know how to use it. And if it's your first time seeing that equipment, make sure to grab that opportunity to really check the equipment. Normally they will give you some time to play with the equipment. Okay. So let's say the OBS machine, let's say the thermometer, make sure you ask them how to use it. Of course, because once they start the time, you can no longer practice the equipment. So make sure, ask the assessor the answers you need before you start the station, right? Next, so remember, it is important to check the person's identity correctly where appropriate. Okay, there are a lot of people, there are a lot of nurses who failed the OSCE because of not checking the identity. Okay, normally, if you're preparing for examination, you know when to check the patient's identity. So normally the stations are, of course, your assessment station, normally your implementation station, you have to check your patient's identity, and some skill station. Okay, and so some skill station, normally stations which requires you to administer a medication. Okay, stations which require you to administer a medication, you have to check if you have the correct patient. Of course, again, you cannot proceed to a station if you haven't verified that you have the correct patient in front of you. Okay, so let's recap, guys. How do we check for the patient's identity? Number one, we check the patient's full name, we check the patient's date of birth, and of course, also it's important we check the NHS number or the MRN, okay, the hospital number. And of course, there are instances that you might need to check the patient's address.